Okay, so we were a little late, sorry. Puppy problems. Anyway, I'm Virginia Lee and I'm so excited to be here sharing with you all of the goodness that oils have to provide for us and our oral health. Okay. First of all, whenever you do any of these things, you always get nervous. A little balance helps everybody. Anyway, rub some of that on. I get highly excitable person. Anyway, that's probably why I started with oils. Anyway, okay. So, to contain my excitement, you'll just have to kind of deal with me. I did basically like a little report because I'm totally a dork like that. But enough about me. You are here to learn about hygiene and essential oils. So, okay. First of all, we kind of want to understand what we're dealing with, okay? So, what is the oral cavity? What does it consist of? What is health? So, we're going to do an overview of those sorts of things to give you a foundation of what health is and then what health isn't. So, then we can go from there on using essential oils to get back to health, right? It's kind of a simple little process. Okay. So if you ask Siri what health is, she will tell you that it is the state of being free from illness or injury. Hi, Sammy. And I will tell you as a hygienist, there is not one person on this earth that is free from illness or injury. Okay? Nobody is 100% healthy. As evidenced by the healthiest brushers in the world will have some area of inflammation in their gum tissues. Okay, that's basically gingivitis. I have a pretty darn healthy mouth, but in some areas there's minimal or minor bleeding, so that area is inflamed and has the area of gingivitis. And you may not know that or understand that, but it's really a scientific thing. So anyway, so can oils help everybody? Yes, of course. Let's talk about the anatomy of the utmost healthiest mouth, okay? So what does it consist of? We have gum tissues, we have teeth, we have bone, and we have a blood supply and nerve supply. So when all of those things are healthy and they are intact, then you have a healthy oral cavity, right? Your gum tissues are pink, your bone levels are horizontal, you haven't had any bone loss, and it's a thick, dense crust that you can see radiographically or on x-rays that you're in health. So there's the baseline of health, okay? So let's now look at our enemy. So in addressing this, we want to know our enemy, right? We want to know everything about them so we can defeat them, right? So it's like we're going to war with the bacteria in our mouth. And we're going to use essential oils. So none of this is in my notes, by the way. So this is probably why I get in trouble. Don't follow my plan. Anyway, okay. We talked about healthy bone, healthy gums, dense crest. Okay. So knowing our enemy, which can cause decay, bad breath, and inflammation. Those are disruptions of homeostasis. So now we want to take those and look at those more in depth. So decay is caused by certain bacteria that they congregate, they talk to each other, and they build these communities that are really intricate, and bacteria are smart. So they build this protective layer around them when they're starting to call each other to come over here and have a party and build this colony, right? And establish a home there on your teeth and therefore causing destruction to your teeth, to your gums, right? So they call their buddies. That's called quorum sensing, this communication system between the bacteria. And then once they start building these bacteria, then they go into this next phase where this biofilm or this protective barrier covers this colony. and it's very difficult to penetrate. So this is where you start to see, if you go outside of the mouth, bacterial problems with antibiotic resistance. It's because that biofilm is this protective layer, like a balloon, encompassing this colony that's so destructive to the teeth and to the gums. Okay, so we want to get at that biofilm, and we want to get that bacteria. First, we want to get the bacteria so it doesn't go to the biofilm and then continue to build and build and build and build and be a huge metropolis, okay, to give you kind of a picture of what the bacteria actually does. So first, what we want to do is talk about the main issues of the trouble of the mouth, okay? There are different causes that lead to an imbalance of homeostasis. What are they? Poor oral hygiene, so people not brushing or flossing or using a water pick. What else? Poor diet, poor overall health, eating terrible foods, just not taking care of themselves, and medications. So we're not going to talk about all of those things. We're just going to touch the tip of the iceberg here and talk about the localized picture of bacteria and poor oral hygiene habits. So those are really easy things to put on the mend, right? So if you're not brushing 2 times a day, which hygienists will tell you, or flossing once a day, or water picking if you have other issues, then you're not doing your first round of due diligence in keeping up on your health. So start there, right? Easiest things first. So not only brushing your gums and your teeth, is you want to brush your tongue, because your tongue is just a haven for bacteria to thrive in. And I kind of don't want to go any farther into it because it's so gross. So why am I a hygienist? Yeah, maybe I'm nuts. Who knows? Okay. I digress. So, okay. Poor oral hygiene habits. Brush, floss. Use a tongue scraper. Use your toothbrush. Get your tongue. If nobody's brushing their tongue, you should start. And in addressing those sorts of things, you're decreasing the amount of bacteria or your bacterial load in your mouth, therefore not causing the problem. Or decreasing the problem of bad breath, the possibility of decay, the amount of inflammation. Do you see where I'm going with this? Okay, so we're going to focus on that bacteria. Here is a note from the World Health Organization. It says oral diseases, such as bacterial infections from decay that are in the oral cavity, are the most common non-communicable diseases and affect people throughout their lifetime. They cause discomfort and pain, disfigurement, and death. So this is one of the number one things. I think anemia is the second. Anyway, so it's a big deal, right? So we want to address this. This is the problem. And the problem causing it is bacteria. So if we can get a hold on bacteria, let's do that with essential oils as our first responders, right? So they are so safe. They have minimal side effects when used properly, and they give you side benefits, right? They amplify your health. Like you're using it for one thing and they aid your health in another way. They're just super kind like that. So, okay, so let's tap into our natural resources that we have talked about, that we will talk about to address the issues of decay, bad breath, and inflammation. So the bacteria cause decay, right? It sits there on the tooth. It starts to dissolve the tooth by way of processing your refined foods, especially sugars, that sort of thing. And then they eat that, and then they spit out acid. The acid dissolves the tooth. You get decay, right? Let's not do that. Let's prohibit that from happening. So, what else do we say? Bad breath. So that destruction, right, is like degradation of tissue. It stinks. It's like if you have a rotten wound and you're not cleaning it, it's going to stink. Same thing. So we want to address that. And anytime there is a foreign invader, you have inflammation. Your host response wants to come and do away with that. Well, the tricky thing about the bacteria is it's in that biofilm. So even if you're mechanically brushing your teeth with the toothpaste and flossing, it likes to stick together. It's a sticky, gooey substance. So you might remove it from over here, but it might go and get placed over here, right? It's moved and disrupted, but it's not like taken out. Okay, so we want to use mechanical application, brushing, flossing, with the killing of bacteria so that the viral or the bacterial load is decreased. So let's get to it with the oils. So cinnamons. Cinnamon, I meant to say aldehydes. The aldehydes, cinnamon, cassia, those oils are super great in the breaking down of bacteria because of their structure. They're highly, oh my gosh, that's the baby. I think I'm going to have to go get her. Hold on. Oh my gosh, sorry guys. Okay, we're back. Can you say hi? The fun of businessing and momming all in one, right? Oh my gosh. So my little helper's gonna be here with me. Sorry about the interruption. Okay, so we were talking about, cinnamon. So its structure is so reliable that it's gonna do the same thing every time when you use it. So that's huge and valuable. It's not a synthetic something that companies alter their structure and then you don't know that it's going to be the exact same compilation the next time you use it. Anyway, let's not go there. So, let's see. So cinnamon and cassia are those of the cinnamaldehydes that provide that reliability. And that helps to, I think I misspoke into that it breaks up bacteria. It helps stop the communication of bacteria. So in the first stages when the bacteria are like, hey, we're over here, come over here and have this party, it stops that communication, which is called quorum sensing. So there you have the inhibition of growing this colony, right? So now you're stopping the colony formation. So now what if, so that's a problem solved. And then what if you have a colony that's already kind of big and you want to get into that and break through that biofilm? You want to use Melaleuca. Melaleuca has been proven to break through that biofilm to disrupt, be able to get in and disrupt that bacteria colony. And then those cinnamons can go in there and help break up the communication so more doesn't come along and build up. Because one thing about bacteria is when it starts building, it has a structural formation. It builds like a house. So at first it builds the foundation and it's not really that bad of bacteria. Then over time it puts up the walls and that's a little bit more destructive bacteria. Then it puts on the roof and that's like terrible destructive bacteria, and so you never want it to get there. This is where major destruction starts happening with the gum tissue and the ligaments in the tissue, and it starts to have implications with bone loss. So this is why we want to stop this from happening, because we want you to keep your teeth and keep everything healthy so you don't have to have bone grafts, gum grafts, scaling and root planing, or the deep cleanings that you may have heard people talk about. Again, I digress. Okay, so we want to eliminate the bacteria by mechanical removal. We want to inhibit the communication by using aldehydes. Cinnamon and cassia are your options there. You want to penetrate the biofilm, which is Melaleuca's job. And then you want to use clove and myrrh for reducing the inflammation. They are great at reducing the localized acute inflammatory response in your gum tissues. So let's see. Oh, okay. So saying that, then when you're troubleshooting in your mouth and you're stopping the trouble in your mouth with squelching the bacteria from building humongous colonies, right? You're also getting the systemic benefit of decreasing the bacteria from going into your body systemically, right? Because when you have that inflammation, the pores in your gum tissues start to transport that bacteria, and that bacteria is not good. And so if you look at the American Heart Association and see that there's a link between gingivitis progressed to periodontitis and heart disease and pregnancy and low birth weight babies because of the bacteria that's in your mouth. So this is a cause for the use of essential oils, right? So you're getting that benefit systemically by stopping all of the trouble in your mouth. Okay. Totally long-winded, I get it. So what can we do, and how do we use the oils that I recommended for these issues? We'll get to bad breath in just a second. I have done what you call upcycling one of my old bottles. So I have put in here On Guard, because On Guard has cinnamon, it has orange, it has eucalyptus, and rosemary. What else did I say? Anyway, those oils work synergistically together, like with exponential benefits because of their structure. And so that's the cinnamon portion. So that's going to inhibit the communication, right, between the bacteria. So we've got that one covered. And then I put in Melaleuca. So On Guard, Melaleuca. That's going to attack the biofilm that protects the bacteria. That's in here. And then I put in myrrh, because myrrh, clove is in. That's the one I forgot that's in On Guard. And then I put in myrrh. So I put equal drops of those in here and then fill it with fractionated coconut oil. And then I put a drop on my toothpaste. So when I'm brushing, I'm doing the mechanical removal, right? And then I am also targeting the remaining bacteria that is there causing the destruction. I'm targeting them with the oils, right? So it's like doing the Kung Pao to them, getting them totally out of there and totally up-leveling your oral health. If you up-level your oral health and you stay healthy that way, your systemic health will also benefit. So that's why oils are so beautiful, because you benefit so greatly by the vast variety of uses that they all possess. So, okay. So yeah, I just do a drop. It's ready to go. It's easy to use. You make it, this lasts forever. And then a couple other things that I want to touch on are oral hygiene. Can, if it's a systemic thing, your gut bacteria has a big part in your health and your inflammation response. So by using probiotics, you got stuff to say too? To get the right bacteria in the game, using a probiotic to contribute to gut health will give you systemic health benefits, right? And then if you're doing double duty by using your little concoction in your mouth, you're also going to contribute to the decrease of bacterial load systemically. So you're getting it both ways. And then oils for bad breath. I would use this, right? It has On Guard, so you're killing the bacteria and all the communication problems. And then any menthol, so peppermint, spearmint, you can use those afterward to keep the proper blood flow and to eliminate some of those odors, which are, you know, a lot of it are on your tongue, on the back. So if you're not brushing your tongue like we talked about at the beginning, way back at the back, you want to, there's divots all over the place, little valleys, and harboring, oh, hold on, Brie, I'll let you know, harboring bacteria. So you want to scrape your tongue, okay? Use your drops of oil on your toothpaste, brush all around your gums, your tongue, and then after, I just do a drop of peppermint on my tongue. I know it's really powerful, so you might want to use one of the beadlets, the peppermint beadlets, which are about 1/4 of a drop of peppermint, and there you go. I use the beadlets on a daily basis. Being a hygienist, you know, you can't really have bad breath, and I drink my coffee on the way to work, so I have to just pop one of those in and hit up my next patient. They have no clue that I had coffee. So, so drops in here. I just do equal drops. I have done 20 of each in here, and then done coconut oil. I'm not really a spicy person, and so with the clove and the cinnamon in the On Guard, I have found that kind of dilutes that sensation for me. So you can toy with it. Just do equal drops. You're going to get the benefits. The molecules in these oils are like so tiny. You're getting them if you put in 10 drops or 30 drops. So don't let that, hey Kelly, don't let that inhibit you. So play around. This is the fun thing, is oils are so fun. You can do whatever you want that suits you. One person like my husband will just do straight cinnamon, and I mean, that makes me breathe fire. So that's not my thing. So I'll dilute, okay, and that's fine. We're still a happy married couple. It's fine. So I hope that was helpful. If you guys have questions, then holler, and I'll check back in the notes. If you guys put anything in the comments within the next 24 hours, then I will reply to that. I hope I didn't give you too much background on bacteria. Once you kind of know what they do, it's interesting. And then you know how to fight them, right? That's the best part. So don't worry, sign me up. I'll figure it out, and then I'll share it with you. I think Keely wants us to have a bullet pointed something. I mean, do you want to bullet point this? Maybe. Oh, I'm like the nutty professor over here. So, okay. Oils for bacteria. On Guard, Melaleuca, that contribute to bad breath and decay. Inflammation, oils for inflammation, clove and myrrh. Yes, there are a multitude of other oils, but we'll just stick with these. Like I said, we're just touching the iceberg. And then for refreshing your breath, anything menthol, peppermint is the number one go-to for me. So I hope that was wonderful for you. Sorry about some of the troubles. And pop any comments in. And let me know once you guys get your little concoctions made. I want to hear about what you think and any changes that you made. Okay? Oh, the reason why clove is anti-inflammatory, didn't even get to that. You guys, clove is the highest antioxidant essential oil, the highest capacity of antioxidative properties. That's what I want to say. So it reduces acute and local inflammation around the teeth. So there you have it. So go get it. Okay, sorry, bye.